Why Are You Leaving? A Model for Improving Employee Retention by Cynthia Clark. In many healthcare organizations, it has been a common practice to reward excellent and loyal clinicians with supervisory or management roles. The Laurel Valley Medical Center was no exception. Grace was a registered nurse on a general surgical floor for 18 years when a nurse manager position became available. Grace was a smart and compassionate nurse with consistently stellar annual performance evaluations, and she was well liked by her coworkers. There was no hesitation by the nursing director to recommend that HR promote Grace to the nurse manager role. Even though Grace had no business management experience or education, it was expected that her experience as a nurse in the organization for 18 years had been adequate to prepare her for a successful career as a nurse manager. Within 12 months, it became apparent to Grace that the idea that she had of being a manager and the expectations that the organization had for her as a manager did not align. Even so, Grace endured in the role. The responsibilities of the job kept her away from the staff and the patients, which had initially been her source of job satisfaction. She was ill prepared for the constant employee relations issues, so she avoided the employees and procrastinated when addressing employee performance issues, hoping that the staff would eventually work it out. Not surprisingly, employee turnover doubled in Grace's second year, putting even more pressure on Grace and her staff to find coverage for the vacant shifts, time to interview and hire replacements, orient and train the new hires. The HR department at LVMC got busy reevaluating the pay and benefit structure, providing incentive packages to motivate the existing nurses to pick up the extra shifts, and they planned a pizza party for the department to bring up the employee morale. Little thought was given to the direct cause of this employee turnover: an ill equipped and ineffective manager. Have you ever heard the saying that employees do not leave their jobs, they leave their bosses? As I was researching for this paper and presentation, I found nearly unlimited amounts of surveys and polls and um, all backing this saying or quote. For this purpose, I just picked a handful of them to share with you. According to Fletcher in 2001, immediate supervisors are related to job dissatisfaction more than any other factors in nursing. And then Snyder in 2015 reported on a Gallup poll that was done on worker-manager relations. And he found that about 50% of those surveys left a job to get away from their manager. And I really like this one from a 2012 Parade survey that found 35% of respondents indicated that they would forego a substantial pay raise if instead they could fire their bosses. Those facts are hard to get away from, and they definitely indicate the need for organizations to look at their managers. While organizations can attempt to retain employees by increasing pay and other benefits, these changes do not correlate to higher employee engagement. Research also shows that when employees are satisfied and engaged, the quality of their service and their productivity increases, which leads to improvements in the organization's bottom line. While many factors are contributing to voluntary employee turnover, accepting that the effectiveness of managers plays a role in the employee's decision to leave and creating strategies to measure and address any management issues identified is a direct approach to decreasing turnover. The effects of this ineffective management problem is far reaching. As you can imagine, managers that are ineffective often lead to employees that are disengaged. And this lack of employee engagement results in loss of productivity, decline in employee morale, issues with patient safety, the quality of their work. And we also know that a lot of times HR departments, instead of addressing that issue, will find people are leaving, we need to throw money at it, and that's why they're leaving. So they increase their pay, they increase the benefit package, hoping that this gets people to stay or pulls people in. So that's costing us. And then in turn, this increased turnover, regardless what the reason of that is, we know that a large portion of it comes from management. And it's the same things that you see everywhere with turnover. It costs more than to advertise, to pull people in. If you didn't have the turnover, you wouldn't have to be putting out those advertisements all the time. You're going to need resources to interview, hire, and train new employees, resources to fill the vacant positions, and not to mention the decline again of employee morale when you're constantly having turnover in the department, when you're never getting to work with somebody that has experience and is secure in their role. It's a lot harder when you're the most experienced one. If there's someone else there that can help out, it really does put a burden on the newer employees when it's constantly changing and you don't have anybody to fall back on. I know I've heard people say that I've only been there 4 years and I'm the most senior person. That's frustrating for a department. And that's what I'm mentioning there, the frustration around the staff for these constant changes. And of course, all of this, each piece of this leads to decreased profit margins for the organization. One of the things to consider when we're looking at Grace's situation as nurse manager is, what are our options? Do we just let the ineffective managers go and replace them with other ones? And the truth is, in an at-will employment state, the employer or the employee has the right to terminate the employment relationship whenever it suits them without cause. And Grace is working in Pennsylvania, which is an at-will employment state. So that's one consideration that comes in. The other consideration, especially if you're in HR or you're in a management role, you need to consider whether there's discrimination factors. Are there any protected elements in Grace? Is she over the age of 40? Is she a minority? Is she handicapped in any way? Is there something that you should be aware of that could be seen as discrimination? And you would want to speak with HR about that. But I'm not proposing that that is the effective way to go here. I believe that the right approach with this is to help Grace succeed, because she's never been given that training that she needs, the leadership, the coaching, the coming alongside her. So we are far from saying that we need to let her go at this point. So some of the HR policies and procedures that might come into play as you're looking through this process is, I believe, very important that you start with recruitment and look at, how are we hiring and promoting employees? Investigate this. What led us to hire managers that didn't have experience or were only strong clinically and didn't have anything to show us as far as business management skills? We might need to review those and update the job descriptions. Our textbook, Frieden-Fachtler, shows us that that is really the core, the primary starting place when you're looking at issues in hiring, is to get back to those job descriptions and see what things we have in there that may be leading us astray when we're hiring employees. The other flip side of this is organizational development. I'm sure most organizations have some sort of training programs in place. Are they measuring the effectiveness, or are they just counting how many people they've trained in that um, certain program, or how many people have gone through it? Are they just keeping check marks, or are they measuring the effectiveness of these actual programs? It may be time to do that, and I'm proposing that you do. So step one in the strategy that I'm proposing is to do that. Review your recruiting and hiring processes to make sure that they're designed for successful hiring, and especially with managers for this purpose. Then the second part is very important as well. Review the organization's expectations and work requirements for your managers. If you are expecting your managers to be at 20 meetings a week, and then you're flooding them with paperwork on top of that, are your expectations too much for the manager? Are you really believing that they can effectively lead when they're really stuck in their office or in meetings all day? They really need to be given the time to lead. And if we are not allowing the process that we're giving them as managers the time that they need to be out there and effectively coaching and mentoring and coming alongside their staff, then that's on us. We need to take that back and say, what really do we want from our managers, and how can we support them to get them there? Because it's not fair to look at them and rate them, their management effectiveness, if we're the cause of their ineffectiveness. So I'll get off my soapbox there, but that's just one thing that we need to look at before we can even look any further. So after you've cleaned that road out and cleaned the path for them to be effective managers, then it's time to move to step three. Research the characteristics and behaviors of your most effective managers in the organization. So I came upon these last three steps as I was researching, and I was proposing similar strategies, but I didn't have all the pieces together of what we should do to help our managers become effective leaders in order to reduce turnover. And I landed on this brilliant article called The Case for Measuring Managers at Kronos. So this is a brand new research study that was done in 2018 by Almeida and Nugent, who are both executives at Kronos. And they realized that they were plateauing on their employee engagement scores. They were starting to see some declines in their retention, and they were wondering, like, what can we do about this? And they've seen the same surveys and polls that we have that say, like, managers are a big part of this, but nobody was effectively looking at their managers. And they even admitted that the only management evaluations that they were even doing was the performance evaluations, which were annual and were coming from the senior leaders down. And so nobody was looking at the direct reports and asking them how they're being led. So that was their intention, to create a strategy for doing that in order to improve their managers. So they suggested this on step three, that you really look at your own organization and pull what are the key factors that make the best managers there, what makes them great. Because there are lots of research books out there and articles on how to be a great leader and the characteristic traits of a great leader. You might want to look into that if you're not familiar with that. But at the same time, you want to focus on what makes the leaders great in your organization. It might not be anything groundbreaking or mind-blowing beyond what you've read in other articles, but at the same time, it really allows you to effectively hone those character skills and characteristic traits for your managers and lead them up in that. So start by that, find out what makes them great, and then develop a management effectiveness scorecard. This is step four. Kronos, they called theirs manager effectiveness index, I thought it might not be a bad idea to open this view up a little bit bigger. They were really focusing on getting those direct reports involved in scoring their managers, and I absolutely believe that is vital. I love that you want to question them about things about empowerment, about motivation, about the security they feel, all the different things that whatever you find that your most effective managers are, you want to ask the direct reports about that. Is that how they're feeling? Are they feeling empowered? And get those scores. But then I also feel the reason I call this a scorecard is that we need patient satisfaction scores and patient safety scores and quality indicators. Are they meeting their budgets? Are they managing their business at the same time? So I believe you want this well-rounded view, and that's why I called it a scorecard. But each individual organization can develop their own scorecard and should. They can take hints from and ideas from other areas that have done similar things, but I believe it should be really customized to their own organization. Then step 5, after you've measured all of the managers and you get their scores and you know the low scoring managers and the better managers, you need to provide effective training for these managers, and we need to keep measuring them and keep training them until you get it right. So if you find that your scorecard, the first time you used it, you don't know that you got it quite right. It seems like it's not weighted correctly. Maybe one thing's more important than other things, or it's not bringing out where you want to see where their weaker areas are so that you can build them up. You, instead of throwing this whole thing out, you tweak that, correct what needs to be corrected, and try again. And the same way with your effective training for your managers. If what you're using the first time isn't working and isn't giving them the skills that they need, then try something else, but don't throw out the whole training program and say this was ineffective. I think sometimes we are too quick to throw out things instead of revising them. And really that is what continuous improvement's about, is going back, is it working, what's not working, and keep revising, because I think this is important enough to do that for. So this strategy that I'm proposing does come at a substantial cost. First of all, you have that research and development work, the resources to do that. Not all organizations will have them on hand in their HR department. That might need to be outsourced, which in that case, it would be even more costly. But I think that it is a vital piece that's worth looking into. And then you have the loss of productivity while the employees are completing the survey. That's not a real big cost because the employees regularly fill them in. I guess it's often semi-annual or annual. And then you have the resources to coach, mentor, or train the managers. This is going to take time, and you also might need to consider the backfilling of management duties. If you do discover that your manager has too much on their plate and you need to backfill some of those management duties or allow somebody else to take them on, or another area of the organization take on some of the work, this restructuring or moving, shifting of responsibilities, that could have some cost to it as well. So then the other factor that I thought of was the continuing cost to review and modify this model as needed. So that would take whatever team is developing this, you want to be watching, controlling, measuring, and revising it as you're going. So those are the costs that stood out to me. So the potential impact of this strategy is really a reverse image or a mirror image of the slide that we did a couple slides ago on what the problem is, the true problem, and why it's a problem. Because those same issues that the management being ineffective was causing turnover and causing employee disengagement. Here we have, by using this strategy, we are expecting that we're going to increase employee engagement as the managers become more effective. And that increases productivity, patient safety, quality of care, patient satisfaction, retention rates, and profit margins. And then at the top here, I have the impact on the community. So as this care is getting better and the patients are being more satisfied, I believe that that's going to increase the community trust in the organization. And it's also possible that it will have a good impact or good result on the health of the community, improving that as well. Because as the patients are more satisfied and trusting of the organization, it's likely that they will come to more of the wellness programs and improve their health in that way. So in closing, I just want to say that I understand why organizations are not already doing this. I realize that it's challenging, to say the least, to focus on managers and score them for their effectiveness. It's not a popular thing to do. It's not something that makes everybody feel good about themselves or feel good about their jobs. But if we do it in the right mindset, that we are coming together to assist them and help each one of these managers succeed to the best of their ability, we are actually helping them and giving them hope for success, where they can't be happy when they're not succeeding, when they're being stressed in their roles. I think this is something that is vital for the organization, for both the managers and the direct reports under them. So I'm just proposing that we research, measure, and we support our managers to drive down turnover. Thank you for listening.